Exercise push-up. The plane of movement is the sagittal plane and the axis of rotation is frontal. The joint type is a hinge within the elbow, ball and socket within the shoulder and scapulothoracic. The action of the joint is elbow extension, shoulder flexion and scapular protraction. Muscles activated are the tricep brachii, pectoralis major, anterior deltoid, serratus anterior, and the type of muscle activation is isometric, which is the holding, concentric, which is the up phase, and eccentric, which is the down phase. Squats. Plane of movement is sagittal. Axis of rotation is frontal. The joint types is hinge within the knee, ball and socket within the hip, and gliding within the ankle. Action of the joints are hip extension, knee extension, ankle plantarflexion, which is in the upward phase, and hip flexion. There is also knee flexion and ankle dorsiflexion, which is in the downward phase. Muscles activated are quadriceps, vastus lateralis, rectus femoris, gluteus maximus, hamstrings, and gastrocnemius, and the soleus. The types of muscle activation are concentric, which is the upward phase, and eccentric, which is the downward phase. Side-lying hip abduction. The plane of movement is coronal. The axis of rotation is sagittal. The joint type is ball and socket, and the action of the joint is hip abduction. The muscles activated are gluteus medius, gluteus minimus, and tensor fasciae latae. The types of muscle activation are concentric, which is the lifting phase, eccentric, and the lowering phase. Russian twists. The plane of movement is a transverse, and the axis of rotation is the vertical. The joint type is gliding within the spinal facet and pivot, which is in the vertebra. The action of the joint is spinal rotation, and the muscles activated are internal obliques, external obliques, rectus abdominis, and transverse abdominis. And the types of muscle activation are concentric, which is in the rotation phase, and eccentric in the return phase. Lateral pull-downs. The plane of movement in the lateral pull-down is the sagittal, and the axis of rotation is frontal. The joint type is ball and socket, which is within the shoulder, and hinge within the elbow. The action of the joint is shoulder adduction, scapular downward rotation, and elbow flexion. The muscles activated are the latissimus dorsi, teres major, bicep brachii, and rhomboids, and the types of muscle activation are concentric, which is in the pull phase, and eccentric in the release phase. Shoulder external rotation at pulley machine. The plane of movement is transverse, and the axis of rotation is vertical. The joint type is ball and socket, and the action of the joint is external rotation. Muscles activated are infraspinatus, teres minor, and posterior deltoid. And the types of muscle activation are concentric, which is rotation phase, and eccentric, which is the return phase.